Many people can have cancer without knowing it, but by recognizing common symptoms of cancer, you can stop it before it gets worse. So in this video, you're going to learn 10 early warning signs that cancer is growing in your body. So before I start, I have to clarify something. So all the early cancer signs I mentioned in this video doesn't mean that you have cancer. So different symptoms can have many causes. So this video is not meant to scare you or diagnose cancer. So please don't use this clip to self-diagnose cancer. So to be sure, you have to talk to a doctor. So now that you know that, let's start with the first sign of cancer. So most people with cancer will lose weight at some point. So when you drop weight for no reason, it's called an unexplained weight loss. An unexplained weight loss of 10 pounds or more may be the first sign of cancer. So this happens most often with cancer of the pancreas, stomach, esophagus or lung. So weight loss is a common problem in patients with pancreatic cancer. Cancer-induced weight loss affects how the body uses calories and protein. So cancer can cause the body to burn more calories than usual. It can also cause a breakdown of the muscle and decrease appetite. So a person may notice a change in appetite or desire for certain foods. Cancer may influence a loss of appetite, especially advanced cancer. So weight loss can weaken the immune system and affect how wounds heal. So unexplained weight loss has many causes, medical and non-medical. So often a combination of things results in a general decline in your health and a related weight loss. So other potential causes of unexplained weight loss include Addison's disease, celiac disease, COPD, Crohn's disease, diabetes, stress, or malnutrition. Patients with ovarian cancer often report a sudden bloating that continues for a long time. Ovarian tumors grow buried deep within the abdomen. Tumors often aren't discovered until they are large, so they can cause some abdominal discomfort in the early stage of ovarian cancer. So cancer spreads and takes up space inside the uterus if left untreated. So constipation is another cause of weight gain. It can happen when cancer growth on the ovary spreads to other parts of the uterus. As a result, the abdomen presses against the intestines or colon and impacts the digestion. So weight gain can also be because of thyroid problems, diabetes, and eating animal products. Fever is the body's response to an infection or illness. So people who have cancer will often have a fever as a symptom. It's usually a sign that cancer has spread to a new area or that it is affecting the immune system. So fever is rarely an early sign of cancer, but maybe if a person has a blood cancer such as leukemia or lymphoma. So when your temperature goes up, it's usually a sign that you caught an infection. Cancers including lymphoma, kidney and liver cancer can also make that happen. So cancer fevers often rise and fall during the day, and sometimes they peak at the same time. So other causes of fever include a virus, a bacterial infection, heat exhaustion, extreme sunburn, or certain inflammatory conditions such as rheumatoid arthritis. Pain is usually a sign that something is wrong and that you have an illness or an injury. So when there is a damage to any part of your body, your nervous system sends a message along nerves to your brain. When your brain receives these messages, you feel pain. So having a lot of pain can be frightening, and it can make you think that your cancer must be growing. The size of the tumor doesn't always correlate to the pain you will experience. A small tumor that is pressing on a nerve or the spinal cord can be extremely painful, and a massive tumor somewhere else might not cause you any pain at all. Cancer don't have any nerves of their own, so most pain caused by cancer is the tumor pressing on bones, nerves or other organs in the body. So cancer pain can be acute or chronic. Acute pain is due to damage caused by an injury and tends only to last a short time. Chronic pain can happen because of changes in the nerves. So nerve changes may be due to cancer pressing on nerves or chemicals produced by a tumor. Other diseases can also be the underlying cause of chronic pain. These include rheumatoid arthritis, osteoarthritis, fibromyalgia, stomach ulcers, gallbladder disease, being overweight, and stress. Along with skin cancers, some other cancers can cause skin changes. Skin cancer is slow-growing and often free of glaring warning signs. That can make early detection tricky. So there are few things that you can keep an eye out for when it comes to skin cancer. Before that, you need to know the difference between melanoma and non-melanoma skin cancer. Melanoma is the most aggressive form of skin cancer and the rarest type, so it can spread to other areas of the body, including organs. Non-melanoma skin cancer are not as dangerous and less likely to spread. So melanoma appears on the skin as a new spot or growth or a change in an existing mole. A traditional mole will be even in color, quite small, and appear during the early part of your life. So it will arrive and stay the same and won't change or evolve. So you can use the ABCD melanoma detection guide to check your skin. So this method shows you which signs to look out for when detecting melanoma. So this is what to look out for. Melanoma lesions are often irregular or not symmetrical in shape. Benign moles are usually symmetrical. Non-cancerous moles have smooth, even borders. Melanoma lesions usually have irregular borders that are difficult to define. The presence of more than one color or uneven distribution of color can sometimes be a sign of melanoma. Benign moles are usually a single shade of brown or tan. So almost all of us have moles. So moles appear in childhood and early teenage years, so normal moles usually look alike. Although you may notice one or more skin changes, it does not mean that you have skin cancer. So if in doubt, please visit your doctor. Rectal bleeding may show up as blood in your stool or toilet paper. Blood that results from rectal bleeding can range in color from bright red to dark maroon to a dark terry color. So symptoms develop fast and most causes are treatable and not dangerous. So in some cases, rectal bleeding can be a symptom of a severe disease. Any blood in the stool is not normal. Rectal bleeding can be a sign of colorectal, anal, or colon cancer. Other causes of rectal bleeding include hemorrhoids, anal fissure, diverticulosis, rectal ulcers, and more. A lump in the breast is what we often associate with breast cancer. So 90% of all breast lumps in women in the early 20s to early 50s are non-cancerous, according to the Mayo Clinic. The majority of breast lumps are not cancer. Painless lumps are still the most common symptoms of breast cancer. A woman may notice a change in her breast early on when she performs a monthly breast exam, or she can experience a minor abnormal pain that doesn't seem to go away. So early breast cancer symptoms include changes in shape of the nipple, breast pain that doesn't go away after your next period, a new lump that doesn't go away after your next period, nipple discharge from one breast that is clear red, brown, or yellow, unexplained redness, swelling, skin irritation, itchiness or rash on the breast, swelling or a lump around the collarbone or under the arm. A lump that is hard with irregular edges is more likely to be cancerous. So having one or more of these symptoms doesn't mean that you have breast cancer. A nipple discharge, for example, can also be due to an infection. So see your doctor for a complete evaluation if you experience any of these signs and symptoms. At least half of people diagnosed with lung cancer have chronic cough at the time of diagnosis. A chronic cough can last for at least 8 straight weeks. Other symptoms of breast cancer include coughing up blood, feeling a shortness of breath, and chest pain. Some people experience hoarseness before their diagnosis. All the early cancer signs I mentioned can also be because of asthma and allergies, COPD, GERD, respiratory tract infection, air pollution, and acute bronchitis. Cancer thrives in an acidic environment and doesn't survive in an alkaline environment. So many of the foods and drinks we consume are acidic, such as animal products and processed food. So everyone with cancer has low pH levels. This is because cancer thrives in a body that is acidic. So when cancer grows, they produce even more acid. So you can check your pH levels by using a piece of litmus paper in your saliva or urine first thing in the morning. So do it before eating or drinking anything. You then compare the color of your litmus paper to the color guide. So you want to be in the 7+ range. So cancer patients can have a score of 4.5 or lower if their cancer is terminal. So if your pH level is this low, then it's important to eat more alkaline food. So there are many supplies of pH papers. You want to buy a pH paper with a narrow range, measuring pH from 4.5 to 7.5 or 4.5 to 8.5. So you can buy litmus paper on Amazon or eBay. Fatigue is common in cancer patients. It can be the most troubling symptom. So the fatigue that comes with cancer is different from the fatigue of daily life. Every day, normal fatigue usually doesn't last long. It often gets better when you rest. Cancer-related fatigue is worse and causes more distress than regular fatigue. Cancer people feel weak, listless, drained, or washed out. Some may feel too tired to eat, walk to the bathroom, or even use the TV remote. It can be hard to think as well as move your body. So rest does not make it go away, and any activity can be exhausting. So fatigue or weakness doesn't mean you have cancer. Other causes of fatigue include thyroid or adrenal problems, depression or severe stress, an unhealthy diet consisting of animal products, malnutrition, and other problems. Insomnia is when you have trouble falling asleep or staying asleep during the night. It may cause tiredness, low energy, poor concentration, and irritability during the day. So sleep disorders are typical in patients with cancer. Inadequate sleep can lead to obesity, diabetes, stroke, heart disease, and cancer. Adults need to get 7 to 8 hours of sleep a night to have a healthy immune function and mental health. Most adults have some trouble sleeping because they feel worried or nervous. Other causes of insomnia include depression, unhealthy sleeping habits, or medical conditions that cause physical pain such as arthritis, asthma, and neurological condition or more. Today I talked about 10 early warning signs that cancer is growing in your body. So weight loss and loss of appetite is a common problem in patients with pancreatic cancer. Fever is rarely an early sign of cancer, but maybe if a person has a blood cancer such as leukemia or lymphoma. Cancer causes pain if it presses on bones, nerves, or other organs in the body. Other cancer symptoms include unusual skin problems, bloody stool, lumps, nagging cough, low pH, fatigue, or insomnia. I hope you discovered that by recognizing the common symptoms of cancer, you can stop it before it gets worse. If you enjoyed this video, then press the like button and subscribe to this channel. Share this video on Facebook and Twitter to your families and friends. Please visit our blog at cancerwisdom.net to learn non-toxic ways to treat cancer. As a bonus for joining our newsletter, you also get access to our free resource library. Download our free guides about diet, detox, emotional healing, and more. Leave a comment and we answer you. Thanks for watching, and I'll see you soon.